Hello everyone, my name is Tejas Nakte and my coordinator names are Ujwal Nandan and Sumed Naik. We are studying in final year B Pharmacy from Shivaji Rao S. Zonle College of Pharmacy. Today I am going to explaining about monoclonal antibodies, guided by Dr. Nitin Mohire, professor and principal of our college. Let's first discuss what about monoclonal antibodies. Monoclonal antibodies are identical immunoglobulins generated from single B cell clone. These antibodies recognize unique epitope or binding sites on a single antigen. Derivation from a single B cell clones and subsequent targeting of a single epitope is what differentiates monoclonal antibodies from polyclonal. Polyclonal antibodies are antibodies that are derived from different cell lines. They differ in amino acid sequences. Characters of monoclonal antibodies. Monoclonal antibodies or MAB are single type of antibody that are identical and are directed against a specific epitope, that is antigen or antigenic determinant, and are produced by a beta cell clone of a single parent or a single hybridoma cell line. A hybridoma cell line is formed by the fusion of one beta cell lymphocyte with a myeloma cell. Some myeloma cells synthesize single MAB antibodies naturally. Preparation of monoclonal antibodies. Monoclonal antibody production or MAB is produced by cell lines or clones obtained from the immunized animals with the substances to be studied. Cell lines are produced by fusing B cells from the immunized animal with myeloma cells. To produce the desired MAB, the cell must be grown in either of two ways, by ejection into the peritoneal cavity of a suitably prepared mouse in vitro method or by vitro tissue culture. That is in vivo method or in vitro method. There are two ways to produce monoclonal antibodies. The vitro tissue culture is the method used when the cells are placed in culture outside the mouse in a body with flask. Now we'll see categories of different monoclonal antibodies. For COVID-19, monoclonal antibodies are laboratory made proteins that mimic the immune system's ability to fight off harmful pathogens such as viruses. Casirivimab and imdevimab are monoclonal antibodies that are specifically directed against the spike protein of SARS-CoV-2, designed to block the virus attachment and entry into human cells. So, for COVID-19, the drugs used such as casirivimab, imdevimab, and sotrovimab as a monoclonal antibodies. Second, for HIV, ibalizumab, a long-acting monoclonal antibody that prevents HIV from entering cells, kept HIV suppressed up to 10 years in people with highly resistant viruses. Example is ibalizumab and its trade name is Trogarzo. For pregnancy, to determine and diagnose pregnancy, different monoclonal antibodies are used. Pregnant women produce a urine with high concentration of human chorionic gonadotropin, that is HCG. Monoclonal antibodies that bond with HCG have been engineered to also carry color granules. Thus, a change in color in a pregnancy test confirms pregnancy. Examples: natalizumab, ocrelizumab, or rituximab. Fourth, for cancer, some monoclonal antibodies can trigger an immune system's response that can destroy the outer cell, that is membrane, of a cancer cell. Blocking cell growth. Some monoclonal antibodies block the connection between a cancer cell and proteins that promote cell growth, an activity that is necessary for cancer growth and survival. Example: alemtuzumab, cetuximab, densumab, and cemiplimab. Now we'll see in detail about cemiplimab. Cemiplimab is a programmed death receptor 1 blocking antibody used to treat metastatic cutaneous squamous cell carcinoma. Here is the structure and molecular formula of cemiplimab. Now we'll see pharmacodynamics of the cemiplimab. Bonding of the programmed death receptor, that is PD ligands PDL1 and PDL2, to the PD-L1 receptor, which is found on T cells, inhibits T cell proliferation and cytokinin production. The upregulation of PD-1 ligands occur in some tumors, and signaling through this way may contribute to the inhibition of active T cell immune surveillance of tumors. Cemiplimab is a recombinant human immunoglobulin G4, that is IgG4 monoclonal antibody, that binds to the PD-1 receptor and blocks its interaction with PD-L1 and PD-L2 ligands, causing PD-1 pathway mediated inhibition of the immune response, including the anti-tumor immune response. In mouse tumor models, blocking PD-1 activity resulted in decreased rate of tumor growth. Pharmacological action of cemiplimab. Cemiplimab inhibits tumor growth by an immune-mediated mechanism, especially by the inhibition of programmed death receptor 1, that is PD-1, treating cutaneous squamous cell carcinoma. Uses. Cemiplimab is indicated for the treatment of patients with curative surgery or curative radiation. Cemiplimab RWLC is used to treat certain types of skin cancer and lung cancer. It works by changing the action of our own immune system, directing it to attack cancer cells. There are some side effects also. New or worsening cough, shortness of breath, chest pain, fast or irregular heartbeats, swollen glands, a seizure, severe headache, confusion, hallucinations, severe muscle pain or weakness. There are some adverse effects like hyperthyroidism, hypothyroidism, pneumonitis, hepatitis, that is inflammation of the liver, and epidermal necrolysis. Cemiplimab is safe in lactating mother and safe in pregnancy. It is unsafe in children and also with food interaction. Then pharmacokinetics of cemiplimab. Absorption. After a dose of 350 mg cemiplimab administered intravenously every 3 weeks, median steady state concentrations, that is CV% of cemiplimab, range between a maximum concentration of 166 mcg per ml and a minimum concentration of 59 mcg per ml. Steady state exposure was achieved after approximately 4 months. Volume of distribution. The volume of distribution of cemiplimab at steady state is 5.3 liter, that is 25%. Protein binding. Cemiplimab is a recombinant human immunoglobulin G4, that is IgG4 monoclonal antibody, that binds to the PD-1 receptor and blocks its interaction with PD-L1 and PD-L2 ligands. Excretion through liver. Elimination. Half-life is 20.3 days at steady state. Clearance is 0.29 liter per day after first dose and 0.2 liter per day after steady state. Doses. In adults and infants, 50 mg per ml, that is 7 ml single dose through vial. Dosage forms. Injection 350 mg per 7 ml, clear to slightly opacilent, colorless to pale yellow solution that may contain trace amount of translucent to white particles in a single dose vial. There are 2 brand names for cemiplimab. Libtayo, manufactured by Sanofi and Regeneron, cost per injection is Rs 5,300, and Herceptin, manufactured by Genentech, cost per injection Rs 50,000. Note: cemiplimab strengthens your immune system to help your body fight against cancer cells. We are thankful to our President, Honorable Dr. Shivajirao S. Zondle Sir, Secretary, Honorable Dr. Geeta Khare Ma'am, and Principal Dr. Nitin Mohere Sir, for encouragement and guidance for efficient use of social media to spread knowledge through making informative videos. Please like and subscribe our channel for more such videos. Thank you.